I'm with Jennifer Hodgson and Angela Lamson from East Carolina University. Today we're talking about medical family therapy and the successes they've had at East Carolina. First with getting a program up and running, a PhD program in medical family therapy, but also really focusing on the research needs of the medical family therapy community. This is a second try at an interview here at in Dallas-Fort Worth, and I appreciate Jen and Angie being with us today and talking about these things. So if you could just tell me a little bit about where you see the cutting edge of medical family therapy research, perhaps that's a question, or how is medical family therapy research different than other types of research that our students may engage?
Okay, you want to go first?
Some of the cutting edge pieces, I think it's important for people to go back and really read some of the root work that was done in medical family therapy, and even before that, for people who do not know George Engel's work. That has really been such a foundation for our program with the biopsychosocial approach, and we think about that in regard to spirituality as well with Wright, Watson, and Bell and their work with spirituality. That's been a really important part of our work at ECU anyway. And when we think about moving forward and how that is different than marriage and family therapy, it's important for us to think about the research that's not just done in family therapy within medical context or diagnosis, but to also think about what's happening in economics and financially what's happening in the nation with regard to healthcare. We have to think about healthcare policy, nursing, we think about pharmacy. So there are lots of avenues and angles that we need to consider, and our work is also reflective of C.J. Peek's three-world view, that there's a clinical world, and that's what's happening at ground zero with patient care. There's an operational world that really looks at the policies and the procedures of an operation. And then there's the financial world, which not only includes things like reimbursement, but also hospital stays, different kinds of setup based on types of pay. For example, how does care look for the underinsured versus those who have private insurance or public insurance? And I don't know if you want to add a little more to that.
No, I think that's great. And with the clinical, operational, financial, our students plug into the clinical in ways where they're looking at models of intervention, perhaps integrated care models, and what do trained family therapists add to those models that's a little different perhaps. So our students may do some family-centered approaches in exam rooms that may not normally be seen, and we don't really have great data on that. So we're looking at compiling more research around inclusion of family support systems in healthcare, and how does that influence patient outcomes, family health outcomes. We're looking at models of care that are briefer. Many times we have 5 to 15 minutes to work with people. So therapists are traditionally trained in the 50-minute hour. We have to figure out how to be effective at the 5 to 15-minute mark. And you can, but it's taking these models and it's taking things we've learned like joining and really turning it on its ear to figure out how we do this effectively and fit into the flow of the healthcare system. I mean, they're pushed to see as many people as possible. So we have to be able to do our clinical work and our research in a way that's natural and organic to the environment that it's in. So we're excited about that. We're looking forward to operational research, which is really looking at how the system is set up and how changes are made to provide integrated care. So the administrative structure, the rooms, we said patient flow, how do you schedule, how do you time things, what do you do when somebody's in a suicidal crisis, and then how do you capture that in research, and adding a behavioral health person to that team is actually going to be effective and not slow down the operations, and in fact provide better patient care. And so these are the studies that are being done, not just by family therapy, but in general for behavioral health. And then the financial, which as we're in need of Medicare reimbursement, we're still looking for a lot of states on how to get same-day billing. So in order to really do what we do, it's having the data to support how it can be effective so we can convince these payers and insurers that they should endorse same-day billing. So it's effective for them financially, to have you and a physician seeing somebody on the same day, because a lot of times that's all you have with a patient, and they may not come back for a while. It's that moment.
As you both talk, I'm amazed at how many variables there are.
Oh yeah.
And that we don't know. Like when I go to my doctor's appointment, I think, hey, he's late, he's running behind, or she can't get me in just yet. And, but all the variables from the waiting room staff and the assessment forms that I'm filling out to the billing information, and then on top of that, you've got that layer of the economic model that that we're in, this marketplace model, as well as the healthcare policy, which changes all the time.
That's right.
So a study that you do on a particular healthcare policy model might, in year X, may not be the same as the same policy or a different policy in year Y. I mean, even using those same variables. So it's a bit of a moving target for research in this area, I would imagine.
It's complicated because, of course, we're relational, and so when you think about a relational dynamic within a medical system, you're not only talking about the interaction for us, it's not just with the patient, but with the patient's partner or the patient's family, and capturing that, but then you also have the complexity of a medical provider or extender that's in that room too. So trying to manage the variables, it is complicated. I think to begin with, there's so much energy for medical family therapy clinically. And in some ways, it's almost parallel to what we're doing right now in MFT with figuring out what does competency look like on one end. And we've had a doctoral student who's now a graduate do a Delphi study on medical family therapy in 2010. And it was really important for us to hear from experts across the nation what they think that is. I think we need to really get some concrete language to medical family therapy, and CJ Peak is working really hard on a lexicon for collaboration and words that we use every day to help make research a little bit better and stronger and
more understandable for the general public who may not know.
Well, if you think about it, you're going to do a lit search on collaborative care. Well, you need to also make sure you're looking at integrated care, patient-centered medical homes, collaboration, co-location. I mean, there's so many different words that people use to just biopsychosocial to describe the same thing. So unless you're aware of all of that, your research will not be complete because you won't be looking at the vast expanse of literature that we have to pull from nationally and internationally. So, I mean, some other countries are doing this far better than we are. And as a matter of fact, the United States is way behind in healthcare. I mean, some would venture to say we're failing. So there's a lot of really wonderful things that we can do as systemic thinkers and as systemic researchers that can really help to maybe unravel some of the ways that we've gotten as stuck as we have.
So I'm thinking about one of the themes from a lot of these interviews that I've been doing is the training that people have had to get outside of their doctoral training. So you two did not have the benefit of being able to attend ECU and get a degree in medical family therapy. And so your paths toward this field and this track of your discipline or this discipline was very different than some of the students that are the up-and-coming generation who can actually go to some of the programs that we have across the country.